Good morning and good afternoon, everybody. If you could just please introduce yourself. Welcome to today's webinar. Introduce yourself in the chat. Please tell us your name and your organization and what country you're calling in from. We're going to give just a couple of minutes for people to join us. Good morning and good afternoon, everybody. If you can go ahead and introduce yourself in the chat, we'll just give one more minute for folks to join us. Thank you for joining us and sharing where you're from. Okay, we'll go ahead and get started. Thank you everyone for introducing yourself. If you haven't already, please do so. We love to see where everyone is calling in from. During today's webinar, we'll stop for questions several times. So if you have at any point during the webinar a question, please share that in the Q&A box rather than the chat. So there's two options. Please use the Q&A box for your questions. For any comments or discussions with each other, feel free to use the chat. We'll also have a few polls during today's webinar. Please participate and contribute to today's discussion by answering the polls. The presentation, as well as the recording of today's webinar, will be available at intrahealth.org/ASAP resources, and I will share that link shortly in the chat with you all. Next slide, please. ASAP has done over 95 webinars for more than 21,000 attendees. So thank you so much for joining us and contributing to these numbers. The webinars are available in 3 different languages, again, at the intrahealth.org/ASAP resources page. To see most of our past webinars, you can go ahead and use that resource, as well as the presentation slides associated with each of those webinars. And most webinars are available in 3 languages, in English, French, and Portuguese. Next slide, please. We have some French and Portuguese language upcoming webinars. So the 2 webinars in this series, the COP22 FY23 expenditure reporting webinar that occurred in English last week, we'll be doing in French and Portuguese next week on September 26th for French and September 28th for Portuguese. Today's FY23 HRH Inventory training will occur in 2 weeks' time on October 5th for French and October 4th for Portuguese. And links are available to register at intrahealth.org/upcoming ASAP webinars. And again, I will share that link in the chat with you shortly. Next slide, please. Today we have 3 presenters with us. We're excited for them to be here. We have Jason Roffenbender, who's a social scientist on the health workforce branch of the Office of HIV/AIDS at USAID. Risa Griffin, a data scientist, again from the health workforce branch, and Kyle Borces, who's a data analyst. And we're thrilled for them to be here to present to all of us. And with that, I will pass it over to the USAID team to continue with the presentation.
Great. Next slide, please. Thanks very much, Melissa. Good morning, good afternoon, good evening, everyone. As Melissa said, my name is Jason Roffenbender, and I'm a social scientist in the Health Workforce Branch at USAID in Washington, D.C. This is the FY23 HRH Inventory Implementing Partner Training. So I hope everyone's in the right place. Next slide, please, Kyle. And Just an outline of what we're going to go over the next 2 hours is we're going to do an introduction to the HRH inventory and an overview of the process. We're going to go through the entire HRH inventory template, particularly highlighting changes from last year's template. But if you're new to HRH inventory, we are going through the entire template. So this should be a good resource to prepare everyone for completing and submitting the HRH inventories. Then we have a couple different staffing scenarios so we can demo the actual final template. And then we'll do an overview of the data reporting process, some of the admin side of things of how to obtain a Datum account, screenshots of actually what it looks like when you're downloading the template and submitting the template, where to go for additional resources, and how to communicate any questions or other issues. Next slide, please. Okay, next slide. So first, I just want to highlight that monitoring human resources for health investments is critical for optimizing current programming and informing sustainability planning. This is the third year we've collected HRH inventory. It's the third year it's been a PEPFAR reporting requirement. And just to get a sense of the volume of staff that are supported through USAID implementing partners, it's over 204,000 individuals. It's over 119,000 FTE. FTE is something that, if you're not familiar, we'll outline later in the presentation. Staffing is a significant investment. It's about 32% of the total USAID expenditures for PEPFAR. And also, across PEPFAR, after commodities, staffing is the single largest expenditure. Also, 54% of USAID staffing expenditures are now through local implementing partners. Next slide, please. So as PEPFAR looks to the next 5 years and beyond, understanding and optimizing HRH is critical to reaching and sustaining epidemic control. Having this more robust data set allows us to optimize and increase our accountability for our staffing investments by providing insight into staff functions, staff locations, and staffing compensation. HRH inventory is a critical input into our short, medium, and long-term sustainability planning. Next slide. I know there are a lot of PEPFAR reporting requirements, and I know many of you were likely on the ER webinar last year or have been in years past. And across agencies within PEPFAR, we've really worked hard to align our reporting with other reporting streams so we can look at this data collectively. And you'll see a lot of similarities or some similarities between what's collected or reported in HRH inventory and what's collected through expenditure reporting. The HRH employment titles are mapped to the ER cost categories. The HRH inventory collects mode of hire, so if they're salaried, contract, or non-monetary, that aligns with how cost categories are reported to expenditure reporting. The program areas, the primary program areas in HRH are aligned to the ER program areas. HRH inventory collects expenditure data, which we'll go through a little bit later in the presentation, and that includes separating salary and contract expenditure from fringe expenditures, which is how it's also collected in ER. Next slide, please. Oh, one last comment on this slide. If you look towards the bottom left, you'll see a little box, sort of an important note. And this time it's noting connecting HRH to ER. But throughout the presentation, that bottom left corner, you'll see if something has remained the same from last year, if it's been enhanced or it was new or is different from last year. But again, there have been, while there were a number of changes from FY21 to FY22 HRH inventories, there were few changes from last year to this year for HRH inventory. So most of what we review will be similar to how it was reported, will be exactly the same to how it was reported last year. There are just a few small changes. Next slide, please. We'll go in more detail of the overall structure later in the presentation, but it's the same process as last year, where the HRH inventory is an Excel template file. Each mechanism will upload and submit one template. Within the template, every row is a separate individual staff member, and that Excel template cannot be modified. Otherwise, it won't be able to be uploaded and submitted into Datum. Once that HRH inventory Excel template is completed, it will be uploaded into Datum, and then it will be submitted officially into Datum. Next slide, please. And so oftentimes we're asked, what about sub-recipients and sub-implementing partners? There's one HRH inventory template per mechanism. So each sub-implementing partner needs to share their HRH inventory data with the prime implementing partner, and what that prime implementing partner submits, the Excel file submitted by the prime implementing partner, will contain or needs to contain all of the staffing data from all the sub-implementing partners. There's one template per implementing mechanism. Next slide, please. Who needs to be included in the HRH inventory and who does not need to be included in that staffing summary? Well, every individual that's received any form of compensation from PEPFAR over the past fiscal year needs to be included in the Excel file that's uploaded and submitted. That's all types of staff: health workers, program management, TA, headquarters-based staff that are charged directly to the IM. If they're salaried, if they have a stipend, if they have a contract, if they have non-monetary support, and that's for prime implementing partners and sub-recipient implementing partners. All staff that meet that criteria need to be included in the HRH inventories that are collected and submitted. Who doesn't need to be included? USG employees, US government employees do not need to be included. Individuals charged to NICRA only do not need to be included. And if that staff member received no form of compensation, then they do not need to be included in the HRH inventory. Next question, next slide, please. Next slide. We're going to briefly go over the reporting timeline. The reporting timeline for HRH inventory aligns with the Q4 reporting timeline for MER indicators for the program data. So we have those same deadlines of when Datum is open and Datum is closed for submission in Q4. So for Q4 this year, October 2nd is when Datum opens for submitting HRH inventories, and that closes November 14th. We do have 2 weeks to review the data, or if there are urgent data quality issues or other things that we want to address. Datum reopens from November 30th to December 15th. That brief 2-week cleaning window is to make any sort of adjustments to what was submitted, if something was noticed during the initial reporting period that they wanted to correct. It is an opportunity another opportunity to resubmit if there are any issues, and we want to make sure that we're communicating to identify those and making sure we can resolve them. Because after December 15th, we will not have any other opportunity to submit any of this data into Datum until next year. The key deadline I really want everyone to think about right now, some of the key dates right now are October 2nd is when you can begin to submit, but you don't need to wait that long in order to access the templates. They are available, they're finalized and available now for download. And later in the presentation, we'll outline exactly where to download them. And starting to fill them out can happen now, but the system won't open until October 2nd. And I really would love if we're adding to our calendars a deadline. The November 14th date is critical. That's when the Q4 reporting period closes, and we really want all HRH inventories successfully uploaded and submitted by November 14th. Next slide. So what do we need to have in order to complete the HRH inventory requirement? One is the template, the Excel-based template that will outline where you can download and is available in Datum now. The HRH inventory guidance materials, you can use this link to access the PEPFAR HRH inventory guidance. It is right now, the link goes to last year. We're expecting in the next week or two to have that updated for the FY23 HRH inventory. But again, when we go over the presentation, you'll see there's really 3 areas where there have been slight adjustments to last year. So last year's guidance is, the guidance will be overwhelmingly similar to what it was last year. You'd also need access, whoever's completing or submitting the HRH inventory will need access to HR or payroll information, as well as information or records that capture where staff are located, where they're doing most of their work. The last thing we'll need is whoever is uploading and submitting this in Datum is going to need a Datum account. And we'll go over this later in the presentation, but if you did this responsibility submitting HRH inventory last year, it's likely you'll need to reactivate your account. If you're doing this for the first time, it's likely you'll need to create a new Datum account, and we'll go through that process at the end of the presentation. Next slide. We're gonna have a quick knowledge check, just to get everyone excited and ready before we really start diving into the template itself. So first question is, what mechanism needs to complete and submit? Which mechanisms need to complete and submit the HRH Inventory Excel tool? And we can put responses in the chat, or there's a poll, I believe, that should have popped up on several of our screens. Okay, Kyle, do we want to go next slide, or the reveal? So all mechanisms that report in ER that have expenditures associated with COP approvals, staffing expenditures associated with COP approvals, would be submitting HRH Inventory Excel tools. And there's one tool per mechanism. Oh, and let's go to the next question. I think I got a little bit ahead of myself. What types of staff should be included in the HRH inventory? Prime partners, subrecipients, program management staff, clinical and ancillary staff who deliver services, or other staff that provide technical assistance and support non-service delivery activities, or F, all of the above. Okay, next slide. Let's do the reveal, Kyle. That's correct. I see a lot of F. That's absolutely right. All staff that receive some form of support should be reported. Health workers, program management, technical assistants, HQ-based staff charged directly to the IM. This applies to prime partners and subrecipient staffing. Next slide, please. Should staff working for subrecipient partners be reported in the HRH inventory? Yes or no? Okay, let's do the answer, Kyle. Yes, all PEPFAR supported subrecipient staff working for a mechanism should be reported. There should be one template submitted per IM, so the prime implementing partner will need to include the subrecipient partner staffing data in their submission. Next slide. When can partners begin to submit completed HRH inventory templates into Datum? Yep, exactly. I see several responses already. That's right. We follow the PEPFAR reporting calendar for Q4, and Datum opens for Q4 reporting October 2nd. Thank you very much. All right, next slide. I'm going to turn it over to my colleague, Risa Griffin, for the next section as we begin to walk through the template. But all three of us are going to be rotating, working through the HRH inventory Excel file and for the rest of the presentation. Risa?
Great. Thank you, Jason. Can you hear me okay?
Yes.
Great. Okay. So my name again, Risa Griffin, and I'm going to take us through some of the Excel template. So Kyle, if you could go to the next slide, please. Okay, so each OU has a designated Excel-based HRH inventory template, and it's really important to remember that each mechanism should download, complete, and submit a single filled template to Datum, so just one with all of the data combined. So now we're going to walk through the key elements of the data entry template. Next slide. So the template contains three main sections: the cover sheet, and this is where background and general information about the operating unit, funding agency, and implementing mechanism will be entered. The staff list, where you'll enter more detailed information about each staff member, and the FTE calculator, which we'll go into more detail on later, but it contains a tool to calculate average monthly FTE for each staff member. In the Excel template, each of these sections is in a separate tab. Next slide. So for data entry, most of the could you go back one, please? For data entry, most of the information will be entered into the staff list section. So that's the second tab. And we will spend most of our time today reviewing this section because it has the most information. Okay, now I'm ready for the next one. So this slide shows you an example of the cover sheet. So that's this first tab. This is where you're going to enter unique information about the mechanism, like the mechanism name and ID, and also the name of the prime partner organization. This is also the section where you will enter the name of the person at the prime implementing partner who can be contacted for follow-up questions about the data entered. So there is one small change to this section from last year, and this is the addition of a field to enter the prime partner's unique entity identifier, or UEI. If the prime partner's UEI is unknown, then you can enter 9 ones in this field. If the prime partner isn't required to have a UEI for some reason, you can enter 9 nines. You shouldn't leave this field blank. So no matter what, you're going to enter something in this field. This section also includes a field where all of the sub-recipients contracted through the prime partner can be listed out. So subrecipients are welcome to complete this section. They're not required to. The prime will enter the information on the consolidated template that is submitted into Datum. So for the most part, the subrecipients don't need to worry about this. Can we go to the next slide? So now we're going to move on to the largest and most detailed section of the HRH inventory template, and that's the staff list. So that will be the second tab in the Excel template. So in this tab, information about individual staff members should be added with 1 row for each individual. In order to submit the template, you have to complete all of the fields, with the possible exception of the datum hierarchy, which you can see here highlighted in blue, also the record number and the comments. We'll go into some more detail on each of these in later slides. In order to ensure that the data is usable, to avoid submission errors, it's important that you don't modify this template in any way. So it's already as you receive it, keep it that way. For the fields where there are drop-down options that are provided, you need to select an answer from the drop-down. You can't type in a response. So this is very important to keep in mind, or you're going to receive submission errors and you won't be able to submit into Datum. Next slide. So this slide shows a complete list of all of the fields that are in the staff list section of the template, and they're in the order that they appear in the template. The fields written in black are exactly the same as last year. So like Jason said, there really is very minimal change from last year. If you did it last year, you're going to feel pretty familiar with the template this year. The 3 fields that are highlighted in orange have been expanded from last year, and I'll provide some more detail on what those expansions entail and what they look like on the next slide. There are no new fields added, so nothing new or that different from last year. So yeah, as you can see, very minimal changes. Next slide. So the 3 fields that were changed or added to are employment titles, where we've added some additional employment titles. These include IP program management, senior leadership, IP program management procurement, and IP program management grants management. These were all added. The goal of these titles is to provide more options to specify employment titles. So before you might have had more staff in another category, but now you can maybe use one of these additional job titles that has been added. Similarly, we've added other dreams as an employment title, and I will explain a little bit more what that means in a later slide. Additionally, in program area, we've expanded to add site level care and treatment, HIV/TB, and the program management classification has been refined so that we specify IP program management rather than just program management. And if you have any questions about these new titles that were added, they are all defined in the HRH inventory handbook. So please feel free to check there as well. But again, I'll go into a little bit more detail in later slides. Next slide. Okay, so now we're going to walk through the site list section and discuss all of the fields in the order they appear in more detail. So the first thing that you will see when you click over to this site list, or sorry, to the list tab in the template is the record number. So this is an optional field. You can enter an alphanumerical value in that field that will be assigned to a specific staff. We don't really recommend using this field. So for the most part, feel free to leave it blank and ignore it. The next field you'll see is where you indicate if the PEPFAR supported staff member is hired through a prime or through a subrecipient IP. If the staff member is working for both prime and subrecipient, then you want to choose which one is their primary employer. And if they are employed through a subrecipient IP, then the third field will be a drop-down menu. Again, you need to select from the drop-down, not type in, where you will select the name of the subrecipient that they are working for. And then finally, on this slide, you can select the gender of the staff member, again, from the drop-down list provided. None of this has changed from last year, so if you did it last year, it should look pretty familiar. Next slide. So the next slide is the employment title. So as I mentioned above, this field did have some additional options added since last year. Nothing was taken away, just some additions added. So here you should select the employment title that captures the staff's primary role. You might not see their exact job title as listed, in their HR record. That's okay. You just want to choose the employment title that is the closest match to their job title. You can only select one job title from the drop-down list for each staff member, and each staff member should only be in a single row of the Excel document. So don't add a second row for the same staff member. When you're selecting the employment title, it's in alphabetical order, so hopefully that can help locate the employment titles more quickly. And as I mentioned before, all of these job titles are defined in the HRH Inventory Handbook. So any questions, great to go there. Next slide. So when you're selecting the employment title, remember that the title should align with the official job title and the work being done, not the training or qualifications of the individual staff member. So for example, if you have a nurse who primarily works in facility management administration, they should be reported as a facility administrator, not as a nurse, even though by training they are a nurse. Okay, next slide. So this is a full list of all of the possible employment titles that are in the drop-down list. So you can see highlighted in orange the changes that we mentioned before from last year. So one of the big ones you see is that we've added IP in front of all of the program management titles. So that's just to make this a little bit more specific. IP program management staff are individuals whose jobs are administrative, financial, and technical planning of program activities. We've also added this IP program management senior leadership. So that's a completely new job title that's been added. And this should capture executive management roles related to program planning and implementation. This could include like a chief of party, a chief of staff, program directors, and other similar roles. Only select this title if none of the other ones fit. And I just want to quickly note that we are seeing questions come in and we will be answering them. So don't feel like I'm ignoring your questions. We'll get to them in a little bit. So then you can also see the addition of this other dreams in orange as an employment title. I'll talk about that a little bit in the next slide. So we could go next. Oh, sorry, next slide. Oh, back one. Yes, perfect, thank you. So here you can see highlighted in red all of the other employment title options. So only select other when truly none of the other staff titles fit. Other is a little bit of a large bucket for us, so it makes using the data a little bit more difficult when we have a lot of individuals in that under that other employment title. So anytime that there is an employment title that does fit, please choose that rather than choosing other. For the newly added employment title of other dreams, this is an option if someone is working under dreams, but they're not a dreams mentor, and they also don't fit into any of the other employment titles. If they fit into any other employment title, please don't select other dreams, only if they don't fit anywhere else and they also are primarily working on dreams. Okay, next slide. So that said, we are really trying this year to get a better idea of who's working on dreams. So if you have a staff member who primarily works on dreams, but they are not a dreams mentor, and their job title does fit well into one of the other options, please select that option that fits their job title, but then use the comment section and just write in dreams. That will really help us to get an idea of the diversity of the dreams supporting staff. Okay, next slide. So we're going to do a quick knowledge check. So if you have a medical doctor by training, but they are working for your program as a technical advisor for HIV care and treatment, should you select doctor or technical advisor as their employment title? And you can go ahead and select in the poll or write your answer in the chat. I think we can move on to show the answer. Exactly. Everyone, it looks like everyone got it. So it's going to be B. We're going to select technical advisor because that's the role that they're actually working in, even though they are a medical doctor by training. Great work. Next slide. Okay, so the next field in the template is the mode of hiring. This is where you indicate how the individual is hired. So you can select the option that best reflects their primary mode of hire, either salary, contract, or non-monetary only. These fields are mutually exclusive. So for example, if you have a staff member who receives a salary and also receives non-monetary compensation, you would select salary as the primary mode. Next slide. So the next two fields in the template are both unchanged from last year. They're where you indicate if the individual is supported by the implementing mechanism is officially designated as a government MOH staff, or if they are seconded by PEPFAR to serve in that capacity, or none of the above. So one of those three options you'll need to select. The next field is the total number of months of work that the individual worked in the past year. Okay, so if they worked the full year from the beginning to the end, you would put 12 there. If someone worked for part of a month, so not a full, maybe they started mid-month, they didn't work the full month, then you can count the number of weeks and enter as a decimal. If they worked half of a week, just count that week. No need to count by the day. So for example, if you have a doctor who worked 3 weeks in 1 month, you would enter 0.75. We'll assume 4-week months here. And don't subtract regular leave days when you're calculating this. Next slide. Okay, so the next item is the average full-time equivalence, or the FTE. So the FTE is a way that we try to understand and measure staffing size when we have some staff who work full-time, but others who work, different variations of part-time. So this is a number that you will calculate for each staff member using that final FTE Calculator tab that I mentioned in the template. So that's the third tab in the template. For calculating FTE, we only want to enter the time that the staff member works that is supported by PEPFAR. So if they are partially funded, for example, by the MOH, you wouldn't include that MOH time in the calculator, only the PEPFAR time. Next slide. Next slide, please. Perfect, thank you. So here are some examples of some different staff time situations that you might encounter and how they can be handled in the calculator. So each of these will have a different section of the calculator, and you can determine which one to use based on the specific situation. You can look back at these once you receive the slides, and I'll talk about them in the next slide as well. Next slide. Okay, so this is an overview of what the FTE calculator looks like. So when you are in the template and you go to that third tab, this is what you'll see. It's a little bit small, but I'll talk through it. So it's very user-friendly. It's very simple to use. So when using it, the first thing you want to do, and this is in the blue box that you see highlighted in the little pull-out, you're going to enter the number of hours in a week that's considered full-time. So for example, for me, for my job, 40 hours per week is considered full-time. So I would enter 40 in that blue box. It doesn't matter if I personally work 20 hours, I'm going to enter what's considered full-time weekly hours. So 40 will go there no matter how many hours the individual staff member works. If for you in the positions you're entering data for, 36 hours is a full-time week, you would enter 36 there. So then after I've done that, I will select which section of the calculator best fits the employee's specific time situation. So that's what was listed in the previous slide. So in this example, we have a worker whose work hours generally remain consistent each week. So let's say they work 20 hours each week. Then I would select option 1 of the calculator. I would enter 20 in that yellow box where I say the hours they work per week. And then it would tell me that the average monthly FTE for this person is 0.5. And I would go back to the staff list staff list tab and enter 0.5 for that worker. The other options are for workers whose hours remain constant in a month, but they vary each week. Then you would use the second option of the calculator. For workers whose hours vary within weeks, you would use the third. And finally, for workers whose hours vary month to month, so maybe 1 month they work 160 hours, the next month they work 100 hours like that, then you can use the fourth section. So you just want to get an understanding of which of the scenarios are the best fit for this staff member, and then choose the section of the calculator based on that. For employees that work full-time, you don't really need to use the calculator. You can just enter a 1.0 as their FTE in the staff list without using the calculator, but you will need to use the calculator separately for each individual staff member who works less than full-time hours. Hopefully that's clear. I think when you're actually using the calculator, you'll see that it's very user-friendly and pretty easy to figure out. Next slide. Okay, so then the next item is where you can specify if the staff member primarily supports the community. And this will mostly apply to ancillary staff delivering and supporting activities such as like social mobilization, health education, etc. Some examples of staff that are commonly primarily supporting the community are listed here. And you can also find a full list in the HRH handbook, as well as a longer definition of what it means to primarily support the community. This is going to be a yes or no answer. Next slide. The next item identifies roving staff. So these are staff who work at multiple facility sites on a regular basis. Roving staff have to be associated with site level program areas. So that means individuals, for example, who work above site or in the community, they wouldn't be considered roving. Similarly, a staff member who maybe one time goes to another site, they wouldn't be considered roving. It needs to be staff members who are primarily, for the main part of their job, going to a variety of different facilities and working in them regularly. Again, this is a yes or no answer for roving. Next slide. And then the next item, this identifies technical assistant staff. Again, a yes, no, are they technical assistant staff? So these are staff who are primarily supporting and improving the delivery of services, but they don't directly interact with patients or beneficiaries in response to their healthcare needs. So this can include activities like if you're conducting a training workshop for staff to improve their technical capacity, or if you're providing guidance to staff on specific topics. All of the above site individuals that primarily facilitate or strengthen services will have yes selected for this item. And that's it for me. I'm going to turn it over to Jason to go through the remaining items of the template. Thank you.
Great, thank you very much, Risa. And I just want to note, we have several Q&A sections coming up in the presentation. I have been responding to some in the Q&A app within the webinar, but many others I've copied every single one that I've seen, and we have those responses and we'll share them during the Q&A sections. I also want to note, as Melissa noted, this webinar is being recorded and the slides are also going to be available shortly after this presentation, so you'll have those resources. Picking up from Risa while working through the elements, is the next column M is this position based outside of the US? And please, this is a yes or no response. Please indicate whether this position is primarily based in a location outside of the operating unit. So any international workers such as US-based staff that spend just a portion of their time, that spend a portion of their time supporting the project or mechanism, should leave all the geographic hierarchy columns blank. For regional programs, so not country programs, but for regional programs, if your position is based outside of the operating unit, we still want you to fill in SNU1, which is column N. And we'll go over those SNUs in the geographic hierarchy right after this slide. So again, this is for staff that are supporting a mechanism, but are primarily based outside of that country or outside of that region. Staff that work in a position based outside of the OU should also select above site or program management as their program area. And an example of what we're talking about is an M&E advisor based in Washington, D.C. that provides technical assistance for a PEPFAR project in South Africa. They would be based outside of the U.S. And because South Africa is a country program, we would leave all of the geographic information blank for that individual. Next slide. So these next couple slides are related to the Datum geographic hierarchy. And if you've reported MER indicators or HRH inventory in the past, you're familiar with the administrative units and the organizational hierarchy within Datum, but we're going to go over that section sort of a number of different ways in this presentation over the next 5 minutes or so. This was an area where 2 years ago, there were a number of questions. We made some changes. We worked with SGAC in the interagency space to try to make it a little bit easier and a little bit clearer. And last year, it went quite smoothly. So we're going to present this a number of different ways. And again, these slides are available after this presentation. And this information, so you can see some of the tables we've created that are hopefully helpful resources. And it's also going to be included in the HRH Inventory handbook that's published by SGAC. Separately, if there are questions related to anything we've talked about, we are going to be circulating, like we've done last year and the year prior, a frequently asked questions resource and document with the missions and our HRH POCs. So that should also be shared with all of you as another way to communicate and ask questions and get clarity around any of this guidance. So for these next couple columns, it's about selecting the geographic hierarchy component that corresponds to the primary location where the work was performed. In instances where individuals work in multiple locations, it's about indicating where the majority of the work was performed. And if the work was split evenly, truly 50-50, then please select one. Generally, the sort of mantra is, how granular do I need to go? How local do I need to go for this staff member and what I'm entering into the template? And we'll go over that over the next couple slides. Next slide, please. And could click one more time so we can see that example. So I'm going to go over a couple terms that, I mean, those that have done this in previous cycles are familiar with some of this language and nomenclature, but OU stands for operating unit, which we have 3 units. We have 3 regions in PEPFAR, and the rest of the operating units are countries. SNU stands for subnational unit, which is a smaller geographic area than the operating unit. And those SNUs can get smaller and smaller. So SNU1 will be a smaller geographic area than the operating unit. SNU2 would be a smaller area than SNU1. SNU3 would be smaller than SNU2, et cetera, et cetera, et cetera. And we can think about this, you know, if I think about the United States, it may go country, region, state, town, facility. If I think about, you know, another OU, it might be province, county, district, ward, subward, facility. So SNU1, SNU2, SNU3, SNU4, et cetera, are getting smaller and smaller until ultimately we're at the facility level. So there are 2 distinctions. There's a facility level, which is always going to be the lowest, and there's a community level, which is usually directly above the facility level. And if you've submitted any community-based indicators or community testing into Datum, you're familiar with how that structure is organized. The other dimension is this term called PSNU, priority SNU. And the PSNU it's a designation that's used for PEPFAR strategic planning. That is, you know, so like I know, you know, in Kenya, for example, the PSNU level is the county level, where a lot of strategic planning is done looking across the 47 different counties. An important distinction is sometimes that PSNU level, where the planning is done, is also the community level. And in other operating units, that PSNU level is not all the way down to the community level. So those are distinct. And the reason that's important is because that impacts what type of template you're going to be downloading and completing for HRH Inventory. Next slide, please. So these are the examples of the 3 different templates, but don't worry. There's only one template that you'll be downloading. It just depends on what your operating unit is. And as I said, the distinction between the 3 templates is the first 2 we can see if PSNU is at the community level. The second one is we can see that PSNU is a distinct level from the community level. And the third one is a unique template for regional operating units. So if you look at the OU names on the right, you know, Botswana, Cameroon, DRC, Ethiopia, Malawi, Mozambique, Namibia, Ukraine, Zambia, Zimbabwe. The PSNU and community are the same level, so it's just one column. And that's template number 1. For Angola, Burundi, Cote d'Ivoire, Eswatini, Haiti, Nigeria, Rwanda, South Africa, South Sudan, Tanzania, Kenya, Lesotho, Uganda, and Vietnam, the PSNU level and the community level are distinct. And then for the 3 regions, Asia regional, Western Hemisphere region, and West Africa region, it's just a slightly different template because the SNU1s are actually countries. When you log into Datum, which we'll go over at the end of the presentation, it will already be pre-selected that you can only download the correct template for your operating unit. But for the purposes of this training and wanting to cover everything for all OUs, we are going to go through a table outlining how local each staff member needs to be reported to fill out these columns. Next slide, please. So again, each country must complete the datum hierarchy down to the appropriate geographic level. The appropriate level is based on the location of the worker, and the location of the work is defined as where the individual performs their work. Next slide, please. And so again, this is looking at the datum hierarchy option 1. This is the number of columns you would see if you're Botswana, Cameroon, DRC, Ethiopia. If you're working in Botswana, Cameroon, DRC, Ethiopia, Malawi, Mozambique, Namibia, Ukraine, Zambia, or Zimbabwe. And if that individual is working outside of the OU, as we mentioned on a previous slide, they would say they're not working in multiple sites, and they would not complete any of the geographic information. They would leave all of that blank. If that individual is national or military, they will only fill this information down to the SNU1 level. So they would leave PSNU community, they'd leave that blank, facility blank. If they're an above site worker, they would not be working in multiple sites. They'd select no for roving. And jumping to the end, they would not be facility based because they're an above site worker, but any combination of SNU or PSNU community level would be accepted in the template. So the recommendation is to go as small as is appropriate, but whether or not that information is entered at the PSNU community level or just at the SNU1 level, those will all be accepted in the template. If a staff member is community, it works at the community level, they would not be roving staff, but their geographic information, we want it entered all the way down to that PSNU community level. If they're roving across facilities, they are roving staff. We'd want that information down to the PSNU/community level. And if they're doing facility-based TA, then we'd want that information all the way down to the facility. So anytime there's just a single facility or working in a single facility, the guidance is to have that geographic information go to have all of those columns populated, including the facility column. Next slide, please. This is slightly different, this second option, and this is the template you'll see if your program if your program is in Angola, Burundi, Cote d'Ivoire, Eswatini, Haiti, Nigeria, Rwanda, South Africa, South Sudan, Tanzania, Kenya, Lesotho, Uganda, and Vietnam. This is a template where the major distinction is we see the PSNU level and the community level are distinct. So they're separate columns. There's an additional column in this template. So if that staff member is working primarily outside of the OU, they are not roving staff, and they would leave all the other information blank, geographic information blank. If they're national or military, they are not roving staff, and they would fill that information down to the SNU1 level. If they're an above site worker, they're not roving staff, and any combination of SNU, PSNU, or community will be accepted in the template. They should not be facility staff because they're an above site worker. But if you enter down to the SNU1, PSNU, and or community level, those will all be processed. And we want that information entered as low as appropriate, as local as is appropriate. They're community-based worker, they're not roving staff, but that information, geographic information, should be entered down to the community level. If they're roving across facilities, they are roving staff, and that information should be entered down to the community level. And if they're facility-based staff, then that information, they're not roving if they're based at a single facility, and that information should be entered all the way down to the facility level. Next slide, please. The last template is for regional operating units, so Asia regional, Western Hemisphere region, West Africa region. When you log into Datum, this will be, and you select your IM and you said download the template, this is the template you'll receive. And so if it's international staff, this is that one caveat to staff that's outside of the OU is they're not roving, but you will select SNU1, which is the country level. If you're national or military, any combination down to that's appropriate would be accepted. That's above the facility level. If they're an above site worker, any selection made that doesn't go down to the facility. That's as long as it's above the facility level, it'll be processed. If they're community level, it's down to and including the PSNU level. If they're roving across facilities, it's geographic information down to and including the PSNU level. And if they're facility-based, it's geographic information down to that facility level. So again, you will only see one of these three templates based on the OU you're working in, but we want to go over all three of them. And I think this table will be a helpful resource. It's really that guiding question of how local do I need to report each of these staff members? And I hope this table will be helpful in quickly determining that. Next slide, please. So a quick knowledge check. For community workers that are not attached to specific facilities, how would you answer this question? Does staff work in or support multiple sites? Kyle, can we see the response? So no, staff that are working only at the community level and not attached to any facilities should answer no. The question is intended to capture facility-based workers that move across multiple facilities. Okay, so let's go over that. I see some different responses, and that's what we're here for, and why we're trying to have knowledge checks that are really getting in some of these trickier spaces. If someone's roving, they're facility-based, but they're working across multiple facilities. And so if this is a community worker that's not attached to any specific facilities, is not facility-based, then they would answer no to the question of does staff work in or support multiple sites. Next slide, please. Okay, I am going to turn it over to, I believe, Kyle for the next several slides. And again, I am going to recap all of the questions that we've received in the Q&A, and all of them are excellent questions and points that we're hoping to highlight in this training. So thank you very much, and those aren't being neglected. Kyle?
Sure, thanks, Jason. And hi, everyone. My name is Kyle. I'll be walking you through the rest of the columns in the HRH inventory template. And apologies, there's also some construction in the background, so you might hear something, but hopefully you don't hear anything, fingers crossed. But after I go through the rest of the inventory template, we'll also be going through some staffing scenarios where I will walk through the template for each column, how you would fill out each of the columns based on the staffing scenario. So moving on to the rest of the data collection templates here. So in here, we'll be focusing on primary program area. So in this particular column, essentially you write down what is the specific program area that the staff member is primarily working in. We understand that some staff members can be working on multiple program areas. They could be working on testing, care and treatments, and other above-site activities. But again, for this column, we ask that you select one primary program area that they primarily work in. If they work in two areas, program areas evenly, we ask that you only select one. So this gives us an idea of what is the programmatic area that individual is primarily supporting. And this is a pretty important column for everyone to fill out because it gives us a sense of what they are working on and what they are primarily supporting. And doing a deeper dive into primary program area, you can see here in this table, I know it's a big table, but in the primary program area dropdown, there's different categories. So there are site level program areas, and there are also above site program areas. And then within the site level program areas, there's 4 categories. There's prevention, socioeconomic, testing, and care and treatment. And within those categories, there's even more specific activities within those program areas. And I won't go into the specific definitions of these program areas. Again, they will all be defined in the updated FY23 HRH handbook. So definitely please refer to the HRH handbook if you're looking for the specific definition of the program areas. I won't go through all of them in the interest of time. But one thing to note is that For this year, there is a new program area under the care and treatment bucket, and it is under the HIV/TB program area. So this is a new program area that has been added for this year. And this program area mainly refers to clinical services related to integrated HIV/TB care. And again, there's some better definition and more specific definition for this in the HRH handbook. And this year we wanted to also explicitly define and better distinguish the definition for the above site program area and also the IP program management area, because sometimes there's some confusion and in terms of definitions between what is considered an above site program area and what is considered a program management program area. So just to better define this, when we say an above site program area, as you can see here in this box and the different activities listed here, we're mainly referring to very specific technical assistance activities aimed at strengthening specific areas of the health system. So this is a very specific program area, and a lot of technical advisors usually fit in this above site program area. So if you have a monitoring and evaluation advisor, a health financing advisor, supply chain advisor, they would usually fall under this above site program area because they are providing technical guidance, technical assistance on a very specific topic about and providing expertise about a specific part of the health system, whether that would be human resources for health, supply chain management, public financial management. These are very specific technical assistance activities that usually advisor level positions that they usually fall under. So I would just to sort of better define this, above site program area is very specific, usually to technical advisors that providing very specific technical expertise. And then this is sort of different from program management. So last year this was program management, which sounds very a very big term to use, right? But we better refine it this year to say IP program management or implementing partner program management, which is really us trying to better say that this is referring to the administration of the award, so of the award or project. So when we say IP program management, we mean mainly two things: A, the financial administration of that project or award, or B, the technical design or the programmatic design of that award or project. So IP program management sounds such a big bucket, but we're really talking about how to run the project, or the financial administration of the project, or the technical design or the programmatic oversight of that project. So it's we made it more specific this year so that there's less confusion when we talk about program management. We're really talking about the administration and the technical program planning of that award or project. Just moving on here, in the interest of time, in this table, we're trying to map out the work location and how that relates to the primary program area. So when it comes to the site level program areas, this really only pertains to community level staff, roving staff, and facility level staff. And everybody else, if you're not a site level sort of doing frontline work, you will most likely be under the above site or IP program management program area. So just as a note there. And another note about primary program area. Again, I know that we asked for selecting only one primary program area, but even though you are only selecting one primary program area, you still need to report the full FTE of that worker and the full expenditure of that worker. So if it's a nurse that's spending the majority of their time on care and treatment services, you would put care and treatment as the primary program area, but then put down the full expenditure amount for that nurse and the full level of effort for that nurse. So for example, if you in the template for that nurse, you would put down care and treatment if they're spending mostly on care and treatment as the program area, with a full FTE of 1 since they are full-time, and the full expenditure of 2,500. So even though you're selecting one primary program area, you put down the full level of effort for that staff member. Moving on here, in terms of the next column for primary beneficiary, again, similar to last year, we're asking that you put down the primary beneficiary that the work of the staff member is primarily going towards or primarily supporting. This includes frontline service delivery workers that are specifically targeting specific beneficiaries, whether that would be key populations or young women and adults and females. We ask that you, to the best as you can, put down the primary target population that program is moving towards. So for example, if you are a CHW that's mainly doing outreach works for AGYWs or young women, adults and females, then you would put down females, young women, adults and females in that category. But also additionally, if you are more above site worker, if you are, for example, a program manager that's not necessarily doing frontline work, but is part of a PEPFAR project that is targeting key populations specifically, then you will put down key populations for that project manager as the primary beneficiary. We'll do more of a deep dive on this later in the staffing scenarios. Moving on to the next column here, we also ask for you to designate whether that staff is service delivery or non-service delivery. So hopefully this should be self-explanatory. Service delivery, direct service delivery is mainly referring to staff doing usually frontline work, providing direct interaction with the beneficiaries themselves, especially a lot of community health workers, for example, are direct service delivery workers. And then non-service delivery workers are usually the more above site workers and program management type of workers. So for example, this would be the project managers or that's not doing frontline work, but is still doing work to facilitate the program. And also in the HRH handbook, we also try to map employment titles to whether they are service delivery or non-service delivery. So we do also have that mapping also in the HRH handbook for you to look into. So definitely look at the HRH handbook also. In the next column here, this has been changed and better refined this year. So previously, this column around public health emergencies, this was a column to designate whether or not a staff member was or supported the COVID-19 related response activities. This year, this has become refined and have become broader in that this has been to better refine the language to say that whether that staff member supported any other type of public health emergency. So not just COVID-19 related response, whether that staff member was related to COVID-19 response activities, but this is now brought up to say not only COVID-19, but also other public health emergencies such as Ebola outbreaks, cholera outbreaks, or other types of infectious disease outbreaks or public health emergencies. You would say yes to this field. So it's become broader now than just COVID-19. And then here we have the last three columns in the data collection template. I'll go through these quickly since we do have some staffing number scenarios to get through. Again, for this year, this has been unchanged. So there's three expenditure columns that you will be writing down. First is the annual PEPFAR expenditure, which is essentially you enter here all direct compensation or financial payments to that staff member. And then B, we look at also the annual PEPFAR fringe expenditure, so the estimates of the cost of fringe benefits for that staff member. And then 3 is the annual non-monetary expenditure for that staff member. So similar to last year, we also understand that some staff do not necessarily get direct financial payments, but also get non-monetary payments. For example, that would be household goods or clothing or water bottles or t-shirts that is not necessarily financial payments, but it's also a form of compensation that we are trying to better capture in the HRH inventory. So again, going here into the annual PEPFAR expenditure column, this is again referring to all types of direct financial payments. So salaries, wages, contract fees, stipends, especially also go here. any types of direct financial payments go towards the annual PEPFAR expenditure column. Secondly, the annual PEPFAR fringe expenditure. This is the estimates of the cost of fringe benefits for that staff member. And in this slide, this goes into what we mean by fringe benefits. But again, the cost of fringe benefits, that would be vacation, sick leave, military leave, employer's share for Social Security, employee insurance types of benefits, that would go under the fringe benefits column. Again, all financial payments go into the other column, not this one. So stipends, for example, go to the annual PEPFAR expenditure, not fringe. This is fringe only. And then lastly, we have the non-monetary expenditure column. Again, this is sort of trying to capture non-monetary compensation. So for example, sometimes we would have, I don't know, volunteers, but that would be student volunteers that do not get financial compensation, but may instead get household goods, t-shirts, water bottles, phone cards for personal use to incentivize them to participate in a health program or health campaign. Then you would put down an estimate of the value of those non-monetary compensation into this column. So for example, this is really trying to better capture any sort of volunteer unpaid staff, but is getting non-monetary goods instead. You would put an estimate of that into this column. And just as a note, if, however, that if some of those supplies, equipment is required for fulfilling the job duties, for example, like a bike is needed for you to perform your job for that staff member, you would not include it in this column. Again, this is non-monetary compensation for personal use only. It's not for, if it's required for your role or for your job, you would not include it. It's only for non-monetary compensation for personal use only. And in these next few tables, this sort of provides a breakdown of how you would fill out the three columns, the PEPFAR annual expenditure columns, the fringe column, and the non-monetary column, based on the staffing scenario of that staff member. So for example, if you're a salaried person, you would mainly fill out the annual PEPFAR expenditure and the fringe column, because they usually have salary and fringe benefits if you're usually a salaried worker. For contract workers, usually you would mainly only fill out the sum of annual PEPFAR expenditure only. Maybe they would have some fringe and maybe they would have some non-monetary compensation, but it will mostly, for contract workers, they will most likely be just filling out the annual PEPFAR expenditure column. For non-monetary workers only, for example, if you have I don't know, volunteers or student volunteers that are unpaid staff that do not get direct financial compensation, but instead receive household goods, t-shirts, snacks, or any types of non-monetary goods for personal use, then you would just put down non-monetary compensation as the estimate for that worker. I think that's it for the HRH inventory template. I do believe we have a Q&A section. So Jason, I believe you're moderating this.
Yes, thank you very much, Kyle. We've received a number of questions, and I'm thinking about the best way to go through them all. I'm just going to go down most of them we've responded in the Q&A, but I'm going to go through each question and answer that we've provided. And I'm also going to say again, we're developing, as we've done in years past, a frequently asked questions resource. And so we're going to write down all of these questions, include them in that resource with our answers, with links as appropriate, and share that with our mission POCs that are hopefully then shared and accessible to everyone on this webinar. But looking at the questions, the first one is, can we copy and paste from submissions from sub-partners into the master template? Yes. Yes, you can copy and paste into the primary template that's being submitted. What does U.S. staff mean? Does it mean U.S. citizen or staff based in the U.S.? Well, we're talking about U.S. government staff. So U.S. government staff means that they're employed by the U.S. government. If project ended in the middle of FY23, is HRH still required? It is still required, but we also know that this can pose some challenges if staff are if it's closed down and staff aren't available. So we're going to share an email link, and hopefully if a colleague can put it in the chat, it's going to be on subsequent slides, and it's going to be a resource available to everyone, is HRH-reporting-helpdesk@usaid.gov. That's going to be a resource if you have real mechanism-specific questions that several of us, Kyle, Risa, myself, have access to and can provide specific support. But it is still a requirement, even if a mechanism ended in the middle of the year. But we want to talk through what unique challenges there may be and talk about that together. So please email HRH-reporting-helpdesk@usaid.gov. Would the compliance staff fall under administrative staff or grants management staff? Believe that would fall under grants management staff. For staff members, this is an important one. They're all important, but this is one that comes up frequently. For staff members that change roles within the reporting period, which job title should be selected? This is one caveat to that one row per individual comment that we make throughout these slides. The same person, if they left one role and started a new role, they would be two separate rows in the submission. And I think about, let's say an individual went from well, I don't want to say hypotheticals, but let's say in that first role, they worked 8 months of the year, and then in that next role, they changed positions and worked the last 4 months of the year. That would be two separate rows. One row with that initial position with the 8 months of the year, and then that next row would be the new position, and the FTE would be 4 months of the year with the other details. So that would be the exception to one row, one individual. Kindly clarify the difference between MOH and PEPFAR seconded staffs. For instance, if a government hospital is the prime implementing partner and has staff supporting this project, how do you categorize that? This was a little bit of a longer response that I put in the chat, but all Ministry of Health staff that receive compensation from PEPFAR, in addition to the government salaries, should say yes to this. Staff member that's employed through an implementing partner, but placed in government offices as a secondment should select yes. So staff that are employed by an IP and work in health facilities to deliver health services alongside government staff are generally not considered seconded staff. Seconded staff are most often seconded to national or regional government offices rather than health facilities. We'll definitely include more language for that in our frequently asked questions document. Should all roving staff members be considered above site level? No, roving staff should not be above site. Roving site should still be working at facilities. Their facility level, they're just working across multiple facilities. Kindly advise, how do we categorize employees who are based at a site but conduct routine outreaches? If they spend most of their time at one site, they should be linked to that site. If they spend most of their time providing outreach to other facilities, multiple facilities, classify them as roving. Is everyone with PEPFAR funding required to submit this report? Yes, every staff member whose salary or non-monetary compensation comes from PEPFAR, any salary or non-monetary compensation comes from PEPFAR, should be included in the HRH inventory, with the exception of U.S. government staff and individuals funded exclusively by NICRA. Are subcontractors going to enter their information directly into Datum, or will they do that through the prime? That is a great question. Subcontractors enter that information into an Excel file that they then need to share, that then is shared with the prime. So if you're a prime implementing partner, I would share the template with the sub implementing partner, have them fill out that information, and then I would copy paste what they entered into your prime template, because that's the only file that's going to be uploaded and submitted into Datum. From where do I get the platform, please? We're going to go over in the subsequent section how to access the template, what resources, where in Datum to go, how to download it, exactly what you'll see, and what you need to do to upload it. So that's coming up. Can we copy and paste from submissions from sub-partners into the master template? Yes, you can copy and paste from the sub-partners into the template that the prime is going to be uploading and submitting into Datum. During a year, due to turnover, one budgeted position worked by 2 staffs. In this case, do we need to report as 2 staffs? Yes, that would be, those are 2 separate individuals, and if you would just need to make sure that the FTE and the months worked over the past year are correct. Can you unpack what positions fall under general above site? General above site should be selected if one of the more narrowly defined employment titles or one of the more narrowly defined categories doesn't really fit. That's that sort of general one is an option if there isn't a better option. HRH template, one person per row or multiple rows for one person if they're roving. If they are roving, it's one person per one row. That's just selecting yes for work across multiple facilities. Average FTE per month will be less than one for staff who were terminated or started during the year, also for part-time staff. For the months that they worked, yes. So yes, if they're less than one full-time equivalent, for staff that were full-time but terminated or started during the year, the FTE will be 1, but the months worked will be less than 12. So, if someone was terminated, if one was a full-time employee and they worked for 2 months and were terminated, their FTE would be 1.0, but their months worked would be 2. If someone was a part-time staff, let's say they were 0.5 FTE for 1 month, then their FTE, then they would be FTE 0.5, months worked 1. So regardless of termination or job change, that should be reflected based on how many months over the past year that they worked, and for the months that they worked, what was their FTE during those months. The question about what do we mean by non-monetary expenditure was asked just prior to the slides that Kyle presented on non-monetary expenditures. So I hope that addressed that question. If there's something more specific, let us know. Is the non-monetary actual expenditure or an estimated one? We're looking for best estimates. We know that's a trickier area to submit. So if you have the actual, great, but we're looking for best estimates. Okay. I'm going to stop right there. I think there's a number of other questions that I want to read and before we respond to. Maybe I'll touch on 1 or 2 more. What is DREAMS? DREAMS is programming targeted towards adolescent girls and young women. It's active in some but not all PEPFAR countries. If you receive DREAMS funding, you should be aware of it. If you have a question about that, please reach out to hrh-reporting-helpdesk@usaid.gov, and we can talk more specifically with you. Okay, actually the next section is Kyle working through several demos, which is perfect timing. So Kyle's gonna go through a number of different staffing scenarios for what options you would select based on different circumstances for staff members. And while he's doing that, Risa and I will look at the rest of the questions that have been submitted and respond to those in the next round of Q&A. Kyle?
Sure, thanks, Jason. And yeah, we're just gonna go through the rest of the staffing scenarios here. I believe I have about like 10, 15 minutes, so we'll try to get through as much as we can. But as you can see, there's a lot of staffing scenarios to give as much examples as much as possible and how you would fill out the template based on the position of that staff member you are looking at. So I believe we have about 7 staffing scenarios here. I will try to get through as much as we can in this next 10, 15 minutes. So if you were here last year, great. But if you have not been here before, that's also okay. But we'll be going through them as best we can. I might go through scenario A and scenario B by hand, but the rest I might have to go through in slide format. So let's go with the first scenario here, looking at direct service delivery at one singular facility. So I'll read the staffing scenario here, and then we'll go through the HRH template together to see how you would fill out the template based on the staffing scenario here. So here, we have a female nurse working full-time throughout the entire year at an IP-supported facility. She was hired at the start of the year to provide general HIV care and treatment services, and is paid her salary directly by the prime implementing partner. In the past year, she was asked to divert some of her time to focus on COVID-19 testing as well. And her salary expenditure over the past 12 months was $11,000, and her annual fringe expenditure totaled about $1,820. So how would you fill this out in the HRH inventory template? So I'll try to go through this as much as I can. Hopefully you can share my screen here, and you can see my screen here. So you can see this is the HRH inventory template here. And again, there's 3 tabs. There's the cover sheet, staff list, and FTE calculator. But we'll mainly be going through the staffing list for now. So for this particular scenario, right? We'll just go through this one row here. And for the first column, you have the record number mainly filled as blank, mainly optional, but we recommend to leave this as blank because we don't want any sort of unique identifiers be in the template to identify individuals. And for that scenario, that nurse was, I believe, employed by the prime. So for scenario C, it will mainly be left blank. For the gender for that nurse, I believe it was designated as a female nurse. And then the employment title will have to be a nurse, right? So you would have to go under clinical category, under nurse. If you can find the nurse, there it is, clinical nurse as the employment title. And the mode of hire for that nurse is a salaried full-time nurse. So you put down salary as the category. Whether that staff was seconded or MOH staff, it would be a no. Months of work in the past year was 12 months. The nurse worked for 12 months for the entire year. And she was also full-time, so you would put a value of 1 for the average FTE per month. Primarily support work in the community would be no. And then also, if they work in multiple sites, it would also be no. Sorry, if you're hearing construction in the background, apologies. I don't know if you can hear it or not, but I'm gonna go through this as fast as I can. For providing technical assistance, it would be a no for technical assistance because that is not, the nurse is doing facility services and not doing TA. The position is based inside the OU, most likely so it would be a no. For the Datum geographic hierarchy slides, the ones highlighted in blue, this is just an example here, but since this is a facility-based worker, you would report all the way down to facility level for that nurse. So you would fill out the SNU, and the facility for that person, because that nurse was assigned to a specific facility. You would fill out all 3 for this specific template. So I'm just going to select some specific examples here. We'll just select Central Province as SNU1, SNU2 as another one, and then the facility, you would put on the facility for whatever that facility that nurse was assigned to. For the primary program area, that nurse, I believe, was providing general HIV care and treatment services. So you would put the primary program area would be site level, CNT for care and treatment, and general care and treatment as the primary program area. For the primary beneficiary, that nurse was not targeting a specific population, so it would be non-targeted population. And then for direct service delivery or non-direct service delivery, since she is a nurse, they will be considered direct service delivery. In the past year, did they provide support to other public health emergencies? That would be a yes, because she was providing some work on COVID-19 testing. And then here, the 3 expenditure columns, you would put down usually, in this example, she had the salary expenditure amount was around 11,000. So you would put 11,000 here. And then the cost of the fringe benefits was 1,820. So this would be 1,820 here for the fringe column. And then there was no non-monetary expenditure for this nurse, it would be a 0 for this example. And then lastly, you have the comments column also. If you have any additional comments for the staff member, you would put this here. But again, if the staff member was a DREAMS related staff member, you would put down DREAMS to tag that this person was working on a DREAMS related project. Again, DREAMS is a specific, usually a prevention program targeted towards adolescent girls and young women. But if you are a DREAMS related project, please type DREAMS in the comment section. But in this example, this person was not working on a DREAMS funded project, so you will leave this as blank. Great, so that's scenario A. I know there's a lot to sort of get through here, and I'll try to go through the best as I can, but I think in the interest of time, I'm just gonna go through the rest of the slideshow here. Again, this was scenario A. And this
Kyle,
sort of
would it be
showed
helpful?
you.
Would it be helpful if I read these slides to help reduce the background noise? I'll read maybe the next two scenarios, and then we'll transition to the next section. Is that okay?
Yeah, go ahead.
Okay, let's move to scenario B. And I think that as everyone saw with what Kyle outlined in the tool itself, the way he's laid out these slides is we have the scenario description on the left, and the right, the table has all of the responses correspond to the different columns that you would fill out in the template itself. So if we maybe go to the next, the scenario B slide. Because we just went over scenario A, right? Yeah. Right, we just completed scenario A. Is that right, Kyle?
It's just scenario A, so we're just gonna go through scenario B and the rest.
Okay, perfect. So I'll just read scenario B. It's an example of direct service delivery at multiple facilities. So a female nurse provides HIV clinical services primarily for pregnant and breastfeeding women and works full-time supporting multiple facilities. She was hired halfway through the year. Her salary is paid directly by the prime implementing partner. In the past year, she helped screen and test clients for COVID with part of her time. Her total salary expenditure over the period she worked was $5,500 US dollars, and her fringe expenditure totaled $937 US dollars. So the question about if she was employed through the prime or sub-implementing partner, it was the prime. Gender is female. Employment title is clinical nurse. Mode of hire, salary. MOH staff or seconded to the MOH, no. Months of work in past year is 6 months because she was hired halfway through the year. The average FTE per month is 1.0 because she is full-time for those 6 months. Primarily support work in the community, no. Work in or support multiple sites, yes, because she's supporting multiple facilities. Is she technical assistant staff? No. Is the position based outside of the operating unit? No. And what level should the SNU report down to? And it's down to the community level. That's the lowest catchment area for those individual facilities. What's the primary program area? It's site level, care and treatment, HIV clinical services. The primary beneficiary are pregnant and breastfeeding women. This is direct service delivery. We talk about, in the example, she helped screen and test clients for COVID. So in the past year, she provided support for public health emergencies, yes. Some of her annual PEPFAR expenditures is $5,500 US dollars. Fringe expenditures are $935 US dollars. And the annual PEPFAR non-monetary expenditure, excluding fringe, is $0. Almost all of those options, I think all of them except for the expenditures and the FTE, I think those are, and months work, those are all pull down options. So those are pull down categories. If I quickly look at the different staffing scenario examples that were on an earlier slide, this is a resource. Again, this PowerPoint is available. The slide deck will be available shortly after this presentation, but Kyle has outlined examples of direct service delivery within a community, but not facility-based, HRH advisor, an HRH advisor that's seconded to the Ministry of Health, a project manager providing project management or coordination support, part-time volunteer that receives non-monetary compensation. So we've had a couple of questions about non-monetary compensation, and hopefully that example is useful and clarifying. And the last one is a finance manager providing financial administration. So we tried to outline a couple different scenarios that would utilize different work locations, different responses to the different columns with different FTEs. And hopefully that's a resource to help inform completing this tool. I'm going to, the next section is briefly, I know we have just shy of a half hour left. I'm going to quickly do a review of some of the Q&A before the final section of the presentation. Looking at questions now, kindly repeat, can we copy paste from our source data into the HRH template? You can copy and paste from other HRH inventory templates. So if there's a sub-implementing partner that's filled out the template, you can copy paste that into yours as prime. I would be cautious about trying to do any sort of copying and pasting from non-HRH templates, unless it's exactly right, the exact same spelling, the exact same everything, the exact same order, no hidden columns or anything. It's not going to work and it could cause problems. I would strongly advise against trying to copy from other sources. You can and should be copying, if it's helpful, from anything that's entered in the HRH inventory template, but I'd be cautious about using other sources. Is the latest handbook version the final version, or will a new one be uploaded? Yes, no, it's not the final version, and yes, a new one will be uploaded shortly. That's coming from SGAC, now called GHSD. We're waiting for the FY23 official handbook. We're hoping for it, hopefully in the next week or two. But again, as we've hopefully highlighted throughout the presentation, there have been minor revisions to last year, and I think hopefully we have the updated guidance in the next week or two, but it is very few changes from last year. What will happen if the project will not achieve the dream of 95, 95, 95 at the end of this year? As we work towards achieving those 95, 95, 95 goals, it's more important than ever to report as complete and accurate HRH inventories as we can. How do we report an employment title who worked under 2 employment categories in the fiscal year? I think we've covered this in a previous one about different jobs, and that is an exception to the 1 row, 1 individual, where if they were 8 months in one role and then 4 months in another, they would have both of those as separate rows, and 1 row would have months work previous year 8 and the information for that position, and 1 row months of work in the previous year 4 and as equal to 4, and the other details of that position. Under what circumstance do you have to capture information about a volunteer who was not paid by PEPFAR? If they're not funded at all, no salary, no fringe, no non-monetary through PEPFAR, then they wouldn't be included in the HRH inventory. So if they were a volunteer that received no non-monetary compensation, no monetary compensation, they would not need to be reported in the HRH inventory. Okay. I think there's 1 or 2 others, but I again want to plug two resources: HRH, the email account, HRH-reporting-helpdesk@usaid.gov. For those specific questions, a team of us have access to that account and can respond. And also, these questions we'll be cleaning up our responses, and we'll include them in a resource that we share with missions, so everyone can benefit from some of these clarifications. Next section, please. Okay, so now we're going to go through a little more details again about the timeline and actually seeing in Datum where these resources should be available. So again, there's no need to delay about establishing a Datum account or reactivating your Datum account. If you haven't accessed Datum in that account for, I think it's 90 days, it'll expire. So it should take a quick, it's a quick step to get it reactivated. If you need a new account, it's also, in my experience, there seems to be about a half-day delay for that to be processed, so it should be fairly quick. October 2nd is when Datum opens for templates to begin to be uploaded and submitted. The Q4 submission deadline is November 14th, and we do have a very brief cleaning period from November 30th to December 15th to make some changes if there are some real data quality issues. Okay, next slide, please. So what are the steps we need to do to report? 1 is request an HRH Datum account or request that yours be reactivated by going to register.datum.org. You can log into datum.org and download your OU specific template, complete the template, use the HRH processor app in Datum and upload the template. That will flag a number of errors if there are any. For example, you selected facility level. You said the staff member was facility-based, but then only reported down to SNU1. Things like that will be flagged, so those can be corrected. Then, once successfully uploaded, there's a separate app, the data approval app, and click submit. Those of you or anyone on your team that have submitted MER data are very familiar with the data. I imagine familiar with the data approval app. Finally, you can wait template approval, or you can make any revisions as requested and resubmit up until the submission deadline. Next slide, please. So the HRH inventory processor is an application and data stream within Datum that was created to support this whole activity 2 years ago. In order to submit, approve, or interact with HRH inventory application, existing Datum user accounts will need to be updated or new accounts created. So when you log into Datum or you're creating a new account, if you don't see this app, and we'll do a screenshot in a slide or two, if you don't see this app, that's something that we'll need to follow up on or submit a help desk ticket, because that is the app that you need to download the template and to upload the template. You can still request, even after October 3rd, you can always request to have a new account or have your account activated. So there isn't a delay on that, but there's no need to delay. If you're going to be downloading, uploading, and submitting this template, please request or reactivate your account as soon as possible. Next slide. And again, this is just a picture on the left of what you're going to see. Go to register.datum.org, select request a user account on Datum. You'll enter your information, choose implementing partner. This is key. Choose access to HRH, choose access type, data entry, HRH inventory, and submit data. That will give you access when they create your account to the 2 apps that you need within Datum to download, upload, and submit the inventory template. Next slide, please. It's that similar process. If you have an existing account, you'd want to contact the Datum user administrator about something else. You'll enter this information and just note that you need to update my account to gain access to the new HRH reporting app. Next slide, please. And so where do we go to download the templates? If you log into datum.org, you'll enter your username and password. Next slide. If you go back one. And you'll see up on the right, in the very top, the second thing from the right are those 9 little squares. That's where all the applications are located. You'll select on that. You'll go down to HRH Processor app. Next slide. In the HRH Processor app, you'll select the operating unit, select the copier and your mechanism. And then there'll be there'll be 2 options. There'll be request HRH template and upload HRH template. Next slide, please. This is highlighted in red, or that square in red, where you would request the template, and that should immediately prompt a download into your computer for the template. Next slide. And this is what we'll see. And as Kyle and Risa, the 3 of us outlined, you'll want to complete the cover sheet tab and the staff list tab that we've gone over the previous hour and a half. And those instructions are in the handbook, which will have an updated handbook hopefully in the next 2 weeks. But everything that we outlined in this presentation aligns with the FY23 guidance. And again, it's 1 template per mechanism. So consolidate the subrecipient staffing data and prime staffing data together in the staff list tab for the template that is going to be uploaded and then submitted by the prime implementing partner. Next slide. And again, this is that same view where you've downloaded, you've requested the template, you've completed it, you've added all the information from sub-implementing partners. If you have sub-implementing partners, you're now back to that same HRH processor app, and you're clicking on upload template. You're going to find the template on your computer and you're going to upload that template. Next slide. You'll see one of 2 things. When you uploaded it, it'll either say status success in green, or status red will be red with an error or a list of errors. Next slide. So there's a number of different data validation checks that are done when you initially attempt to upload the file. One of which is what I highlighted earlier, that it's a facility-based position, but then the geographic information may have only been entered down to the OU level or the SNU1 level. That's the type of thing that will be flagged to then make that correction before re-uploading it. There's no limit to the amount of times that you can upload. So if you want to use that as 1 check, please feel free to upload as frequently as you need to see if anything is being flagged. Please don't wait until the evening of November 14th to do that initial submission in case there are a number of validation errors that we need to troubleshoot together. Next slide. Just a couple helpful tips. Looking for completeness, prior to uploading are there any incomplete fields? Are there mismatches that between work location and employment title, like I mentioned. Are there duplicates? You know, it's certainly, it's understandable, of course, if there are multiple people doing the same role for the same time and things like that, but making sure that that's accurate. I know we've got several implementing partners with very large staffs, and we've had a lot of questions in different ways about copying and pasting. Just doing a quick double check to make sure that we haven't copied and then pasted twice, or each row is truly reflecting an individual staff member, or those rare instances where a staff member has changed jobs within the fiscal year. Also check for extreme values. Something that we flagged in years past are ensuring that expenditure data is converted to US dollars. And also seeing if any of those numbers are wildly outside the bands of what else has been reported. Was an extra 0 or 2 zeros accidentally added? Just quick checks like that. And then the geography, it's again making sure that we're using those pull downs, and we're going down to the appropriate levels for the different geographic units that we're selecting in those columns. Next slide, please. So we have now received the green success. What do? This is a two-step process. So we've successfully uploaded the HRH inventory template, and it's green and successful. It is not fully submitted. We need to go to the data approval app. So we go back to those 9 squares in the top right of Datum, click on the data approval app. You'll see you can select the data set and the period, and it should come up where you have a prompt to hit submit. That red button submit is what officially submits it. It is not submitted if you just successfully upload it. It's a 2-step process. We have been working over the last 3 years, and we'll continue to try to not make this a 2-step process, but it's still a 2-step process. So please, once you successfully uploaded it, you need to go to the data approval app and officially submit it. Next slide. Okay, I think this is one last knowledge check. When will you see error messages if something in the HRH inventory is incorrectly entered? A, immediately after you enter the data in the template, errors will appear in red. B, when you attempt to upload to Datum app, you will see an error message. Or C, you will only be notified of errors after the submission has been reviewed by agency staff. Okay, Kyle? B, I think most of you got this. Yep. When you attempt to upload to the Datum app, you'll see an error message if there are any corrections needed for the template to be accepted. Next question, Kyle. I think we have one more knowledge check, if memory serves. Yes. Will Datum accept a template if there are outstanding error messages? Yes or no? Correct. Kyle, can we see the response? All error messages must be addressed by making changes to the data in the template before Datum will accept the submission. So you can upload with the messages and those will be flagged, but you won't be able to submit that actual template unless all of those errors have been addressed. So next slide, and Risa, I don't mean to put you on the spot, but would you mind recapping if there are any other Q&A questions that have come in that we have responses to while I was doing the previous section?
Yeah, no problem. Happy to. Let me just navigate over here. Okay, so I think that where you left off, Jason, someone asked if project managers and coordinators are considered above site. Generally, yes, they would be above site, but occasionally it's just really going to depend on their geographic location and where they're doing the work. And you can find more detail on that also in the handbook. Then there was a question about an individual who, I think you answered this actually. An individual who worked 2 employment categories, so maybe they switched during the year. So that's a rare example where you actually will have 2 rows for one person. The rows are really going to be based on their employment title or the job that they're working. Hopefully that's clear. There were a couple of questions about where subcontractors will get the template. So the primes will create the Datum account and download the template, and then they'll share it out to the subcontractors. When the subcontractors have completed the template, filled in all the data, you'll send it back to the prime, who will compile and then submit to Datum. There was a question also about if the salaries or non-monetary amounts are recorded not in US dollars, in local currency, is there guidance on the exchange rate? So we would just recommend that you use the same methodology or conversion rate that you use for other financial reports that are submitted to USAID. So you don't need to do anything different. So there was also a question about how we would capture information by a volunteer who's not paid at all by PEPFAR. And so we wouldn't collect information about that volunteer unless they at least receive some non-monetary compensation. If no PEPFAR funds are used at all on this individual, then we wouldn't include them in this data set, which, there are pros and cons, but it's really about PEPFAR expenditures for staffing. There's a similar question was about if you have a staff member who part of their work is funded through PEPFAR, but then part of it is funded through another project that is not PEPFAR. How would you enter that? Great question. So for example, if you have someone who 50% of their time is funded by PEPFAR, the other 50% is funded by the MOH, you would enter their information just around the PEPFAR funded part of their work. So you would enter them as being 0.5 FTE, or half of a full-time equivalent, since only half of their time, half of a full-time week is funded by PEPFAR. And then you would enter the expenditures numbers just related to that PEPFAR funded portion of their work. Someone asked about job descriptions for each position under the staffing list. So you can find those in the HRH Inventory Handbook, which will have, so you can find that. I pasted a link, but also I can put a link in the main chat as well. The updates will be coming out soon. Let's see, project manager. Someone asked how to enter project managers for health facilities that are prime IPs. So you would enter them exactly the same as you would enter any other project manager, but in the field where you're selecting if they're prime or sub, you would just select prime. And I think that we have one more question that just came in the chat. Can we have more than one Datum account at a prime level? I actually don't know the answer to that, so I'm going to turn it over to Jason. Is it possible to have more than one Datum account at a prime level?
Yes, my understanding is you should be able to do that.
Great. Well, I think that's all the questions that we had in the chat. If you have any others, please drop them in the chat now. We have a little bit more time, or also please feel free to email us at that help desk email. I dropped it in the chat earlier. I'll do it again now just to be safe, but we are happy to take questions through that email address as well. Thanks.
All right. Thank you very much, Risa. And we have 3 quick last slides just to wrap up this webinar. Kyle, if we can go to accessing GHSD guidance and instructions. We just want to highlight datum.zendesk.com is where you can find some resources, including the PEPFAR guidance, and also where you can do a request to, if you have a ticket of a specific Datum problem, or you need to have some other change with your account, there's a link to do that. Kyle, next slide, please. Sorry, I've got a couple different pop-ups coming at once. We have a number of links within the PEPFAR guidance and the Datum training and tutorial options. There's an introduction to PEPFAR HRH Inventory, a glossary of HRH definitions. There's the HRH Inventory Handbook. Again, this link goes to the FY22 Handbook, but that will be replaced shortly with the FY23 Handbook. And everything that we've presented on this webinar is with FY23 guidance, which is so I do think I would encourage there not being any delay in beginning to fill out the HRH inventory templates. There's a frequent asked questions document there that's managed by SGAC, and some other Datum related links. Next slide, please. So really, what are the next steps? So prior to October 2nd, right now, after this webinar or tomorrow morning, submit at register.datum.org to obtain an HRH Datum account. and ensure that you have access with that account to both of those applications, the HRH processor application and the data approval app. If you haven't logged into Datum for a while, you'll probably need to reactivate your account, so no need to delay. Download the template, review the template, download the template. If you have problems downloading the template, email HRH reporting helpdesk at usaid.gov. We can quickly we can help troubleshoot. Please log into Datum and try to download the template first. But if you have any questions related to this process, we encourage you to use that email link. We'll respond to them as soon as we can and try to provide any specific clarity. And as I mentioned, if you have other questions, please direct them to ACORs, direct them to activity managers and mission HRH POCs. We're all working to support ensuring we have the most accurate and highest quality data submitted for HRH inventory and align with these processes. So use those resources that are available to you. And we're all here to support this activity. And as I mentioned earlier, USAID will be circulating an FAQ where we'll be updating it throughout the reporting period, and we'll be distributing it to our mission POCs. Questions that you have will help others. I think we're seeing on this chat, the questions that have been raised and we've addressed during the Q&A sections, I'm sure apply to many others and many we're thinking about. So we want to make sure that we're constantly updating and sharing that resource for everyone. And the last bit that was mentioned in the previous section is, there's no limit to the amount of times that you can upload, or the two last comments, there's no limit to the amount of time that you can upload these templates to see if there are errors. Please do so. Use that feature to see what type of errors are flagged and then work to address them. And then the last comment is just one more time. It is a two-step process. So once it's uploaded through the HRH processor app, ensuring that you go to the data approval app and officially submit it. Thank you all very, very, next slide, Kyle, but thank you all very, very much. It's a long webinar. It's certainly a big lift with submitting HRH inventory data. We want to provide as much support as we can, and we're really looking forward to another successful submission cycle. So thank you all very, very much, and look forward to working together over the next couple of months on this activity. Thank you.
Thank you, everybody, for joining us. Just once again, a reminder that the recording of today's webinar, as well as today's presentation slides, will be available at the ASAP resources page on IntraHealth, and I've shared the link several times throughout today's webinar. And we would just like to thank Jason, Risa, and Kyle for presenting today on such important and pertinent information, and encourage you all to continue to utilize this resource and share it with any colleagues that might find it relevant. So thank you very much, everybody, for joining us. Have a great rest of your days.
And thank you very much, Melissa, for all of your help.
No problem.